My name is Heun. I'm a consultant psychiatrist, and I'd like to talk about a paper which was recently published in Global Psychiatry Archives. And it's about self-perception of improved mental health among adult babies during the COVID pandemic. Adult babies are people who engage in consensual role play as pre-audible children. They are a minority group which experience stress and anxiety as a result of shame and stigma. And the question the author asks is how the activities of adult babies impacted on or was impacted by the COVID pandemic, and how their activities changed that. So let's go to the tables and to understand easily. So there were quite a few adult babies activities, and the different males and females and some others. And then they would ask, what is this age play, what they're doing as improved the mental health, or doesn't improve the mental health, or made it worse, and has no impact. So the activities they're using were using pacifiers, sippy cups, or bottles, playing with stuffed animals, wearing diapers or pull-ups, getting into little space. Little space is the feeling of comfort and being in a different world. Then there are other activities like TV on watching TV, which was also checked as a control. And then the question is, what happened during COVID? Was the activity more often, or was it less often? So this is something people would then want to assess. On total, there were quite a few people. It was an interview based on from a website, so people came forward themselves, giving the information. And of the males, lots of people felt that the role play or being in this specific space improved their mental health. So 58% felt this. From the female, they felt as well that the activities improved their mental health. And what they did, and so there was an increase, and this is use of pacifiers during COVID, use of bottles, sippy cups increased, stuffed animals, using and playing with stuffed animals increased, use of diapers increased, and getting into this little space of the world of being a baby was increased. They sent more messages to other adult babies, but other activities like watching news, eating healthy, exercising, or getting sleep didn't show anything. Drugs wasn't changed, and religious activities didn't change. So the question was, what was a relationship between the activities and the perception of increased health? And what you can see from table 4 here is that the people felt that the use of pacifiers helped them, use of sippy cups and bottles helped them, and use of stuffed animals, diapers, and getting into little space and communicating with other adult babies helped them in their mental health. So saying this, you can see from the other tables that the PHQ-4, which is a measure of mental health, has some relationship or difference between males and females. So the inability to stop worrying was higher in females, and the anhedonia was higher in females to some extent. And so there were also COVID mean scores, the quality of life scores, and there was lots of poor mental health, physical health, poor physical health, tense feelings, and depression. But in total, what you can say is that the symptoms were alleviated, and people who were babies or adult babies suggested that when they when they're engaging in adult baby activities, it was then seen as a positive mental health effect, and has positive health depression, positive effect on anxiety, but the shame and stigma continued. So, and maybe it's important to educate people that if they do what they want to do, that it helps them, and they shouldn't be too phobic about these aspects of themselves. So it's a hidden population, and they are quite in danger of stigma when they disclose their information, but they should also be supported in using this, or should be accepted in using these baby activities to improve their mental health. If you want to read these articles, please check www.globalpsychiatry.co.uk, and I hope that you might be interested. And if you're more interested in our articles, then check our website of Global Psychiatry Archives. Thanks for your interest, and I hope you enjoyed this. Thank you.